1. A clinical social worker designing a learning plan for supervisees must ensure training activities support adult learners. Which approach best reflects adult learning principles? A. Using real clinical cases to apply assessment skills. B. Requiring memorization of policies without context. C. Delivering lectures without interaction. D. Limiting opportunities for questions. 2. During LICSW exam preparation, which evaluation method best measures higher level clinical reasoning? A. Multiple choice items with obvious answers. B. Case-based questions requiring ethical and diagnostic decisions. C. Questions unrelated to practice. D. True or false quizzes. 3. A supervisor mentoring a social work intern on treatment planning should prioritize A. Encouraging reflective discussion of clinical decisions. B. Providing the final treatment plan for copying. C. Avoiding feedback to reduce pressure. D. Repeating the same advice without adjustment. 4. When teaching social workers diagnostic skills, which instructional strategy aligns with adult learning? A. Connecting criteria to clients commonly seen in practice. B. Presenting diagnosis lists without context, using abstract examples only. D. Avoiding client scenarios. 5. A curriculum developer designing a program for LICSW readiness must ensure A. Objectives align with assessment and practice expectations. B. Materials remain unrelated to real clinical duties. C. Activities avoid interaction. D. Lessons are presented without clear structure. 6. Effective communication in clinical supervision includes A. Using clear, respectful dialogue with opportunities for clarification. B. Speaking quickly without confirming understanding. C. Using overly technical jargon. D. Interrupting frequently. Regulatory standards for LICSW practice require social workers to A. Maintain documentation, confidentiality, and adherence to legal mandates. B. Ignore reporting laws. C. Avoid updating clinical records. D. Disregard informed consent. 8. A strong evaluation tool for LISW trainees' ethical judgment is A. Case scenarios requiring application of ethical codes. B. Memorization of ethics vocabulary. C. Listing rules without context. D. Questions unrelated to ethics. 9. Adult learners preparing for the LISW benefit most when instruction A. Ties concepts directly to workplace experiences. B. Avoids real examples. C. Focuses only on theory. Discourages questions. 10. A supervisor offering actionable feedback on a trainee's client interview is practicing A. Performance-based evaluation. Non-directive avoidance. C. Unstructured commenting. D. General praise without criteria. 11. When assessing risk, clinical social workers must A. Use structured tools combined with clinical judgment. B. Avoid standardized measures. C. Depend only on intuition. Skip documentation. 12. In designing LICSW exam preparation, which curriculum element is essential? A. Sequencing content from foundational to advanced skills. B. Presenting topics in random order. C. Omitting practice items. D. Avoiding skill application. 13. A trainee struggling with cultural humility should receive mentoring that A. Encourages self-reflection and awareness of biases. B. Avoids addressing the issue. C. Uses criticism to induce change. D. Provides generic statements without guidance. 14. For valid LAU assessments, test items must A. Measure what the objectives specify. B. Include irrelevant topics. Use confusing wording. D. Encourage guessing. 15. A social worker developing a service plan that respects client autonomy is demonstrating A. Ethical practice guided by client-centered principles. B. Disregard for client preferences. C. Imposing personal values. D. Avoiding shared decision-making. 16. Effective adult learning environments for LISW candidates include A. Collaborative case discussions and applied practice. B. Passive lectures only. C. No opportunities for questions. D. Memorization drills without context. 17. Communication with interdisciplinary teams requires LISW practitioners to A. Use clear, concise, client-focused information. Share unnecessary personal details. Avoid clarifying information. D. Speak using discipline-specific jargon only. To ensure scoring reliability in LISW assessments, supervisors should A. Use consistent rubrics for all evaluations. B. Change scoring rules each session. C. Score based on personal impressions. D. Skip written criteria. 19. Supervisors mentoring new clinicians should A. Model ethical reasoning and guide reflective practice. B. Avoid discussing ethical dilemmas. C. Provide ready-made answers. D. Limit opportunities for feedback. 20. When evaluating a trainee's psychosocial assessment, a supervisor should check for A. Integration of client strengths, risks, and context. B. Minimal detail with no structure. C. Missing essential information. Random note-taking. 21. Adult learners studying advanced clinical intervention benefit from A. Immediate application through role-play and casework. B. Listening to lectures without participation. C. Memorizing theories without use. D. Avoiding complex scenarios. 22. Regulatory compliance and documentation requires clinical social workers to A. Record timely, accurate, and objective notes. B. Write subjective assumptions as fact. C. Delay documentation indefinitely. D. Ignore confidentiality requirements. 23. Strong LICSW test items evaluating diagnostic accuracy should A. Present detailed scenarios requiring criterion-based analysis. B. Use vague descriptions. C. Avoid client information. D. Present only memorization tasks. 24. In clinical supervision, tailoring guidance to learner needs demonstrates A. Individualized mentoring. B. One-size-fits-all teaching. C. Rigid instruction without adaptation. D. Avoidance of learner differences. 25. Effective communication with clients during assessment requires A. Active listening and non-judgmental engagement. B. Using complex terminology without explanation. C. Limiting client expression. D. Interrupting frequently. 26. To support LISW readiness, curriculum developers should include A. Practice tests aligned with exam domains. B. Unrelated activities. C. Outdated materials. D. Arbitrary content. 27. When discussing ethical dilemmas with trainees, supervisors should A. Encourage analysis using ethical frameworks. B. Avoid exploration of options. C. Focus solely on personal beliefs. D. Discourage questions. 28. Trainees learning crisis intervention benefit from A. Simulated scenarios building decision-making skills. B. Memorizing crisis terms. C. Avoiding emotional content. D. Listening passively. 29. An LIC exam item assessing communication competence should A. Use scenarios highlighting professional interaction skills. B. Avoid practical examples. Test only terminology. D. Include irrelevant details. 30. Supervisors strengthening trainee evaluation skills should A. Teach structured methods for assessing progress. B. Avoid tracking client outcomes. C. Use inconsistent metrics. D. Skip supervision around evaluation. 31. A core adult learning principle in clinical social work education is A. Connecting new learning to prior client experience. B. Ignoring previous knowledge. C. Avoiding relevance. D. Relying only on lecture. 32. Trainees preparing for LICSW licensure should receive feedback that is A. Specific, timely, and actionable. B. Vague and delayed. C. Emotional rather than objective. D. Avoided to reduce stress. 33. To strengthen cultural competence, LICSW candidates should engage in A. Ongoing self-assessment and community-informed learning. B. Avoidance of cultural issues. C. Stereotype-based decision-making. D. Limited exposure to diverse groups. Ethical clinical practice requires social workers to A. Uphold confidentiality, informed consent, and professional boundaries. B. Share client information casually. C. Use coercion to gain compliance. D. Ignore established guidelines. 35. In mentoring sessions, reinforcing trainee strength supports A. Confidence and professional growth. B. Avoidance of skill development. Increased dependency. D. Reduced engagement. 36. Effective evaluation of intervention outcomes requires A. Measurable goals and observable progress indicators. B. Vague objectives. C. No follow-up assessment. D. Ignoring client input. A well-designed LICSW curriculum should A. Integrate ethics, assessment, intervention, and supervision competencies. B. Focus only on one domain. C. Exclude applied learning. D. Contain only reading assignments. 38. Communication barriers in clinical interviews can be reduced by A. Using open-ended questions and supportive body language. B. Avoiding eye contact intentionally. C. Speaking in a rushed manner. D. Asking only closed questions.